This project was inspiring and also life-affirming.
Empowering to me, empowering to our staff, empowering to our patients, and really empowering to our health system.
This project brought patient-centered care to a new height.
What I've seen over the last 30 years is that we've become more and more patient-centric. You know, it really used to be a very provider-centric profession. You know, it was all at the convenience of the provider and how we would do it. We're the experts, you come to us, we run everything, we're in charge. Now it's really shifted.
As a physician, I found that the patient health questionnaire made it easier for me to help my patients with depression. It allowed me to have that information at my fingertips as soon as I walk in that examination room.
Through this one screener, we're able to tackle a lot of different health issues and social issues at the same time and have it all documented in the same place.
The computers actually prompt our medical assistants to ask these questions so that something that wouldn't normally be done universally is now done universally in this practice. And then it also presents the information to the providers in a way that's right in front of the provider when they're seeing their patients.
This phenomenal way of thinking about a new way to listen to patients in a structured way, a way about the results of their care, what really matters to them, what are the barriers they're facing in a very systematic, structured way so that you can make improvements, that you can actually then institute new interventions, new practices, new systems to drive an improvement in those areas.
I was working with a woman who just had moved from out of the country. She was pregnant and she was completely alone. And even though she was living in a shelter, what her biggest stressor was actually labor and delivery. She had no one to go to the hospital with her. And we were able to get her connected with a doula who she's been working with for several weeks now, and she definitely feels less stress into going into giving birth. And if you just had looked at her in terms of what her concrete needs were, living in a shelter or food, you wouldn't actually be understanding what her true priorities are and what her stressors are and priorities and goals are.
A patient who sticks out for me is a patient who actually came into the clinic complaining of chest pain and shortness of breath. And through the screening, the primary care provider learned that she was actually experiencing abuse in her home.
I mean, we know that providers in general focus on clinical problems. You know, they're trained to do medical care. And so we also know that they know about these things, the influences of social factors on the care that they give, but they don't often have the space or the time to ask the questions. And there's so many requirements being put on medical providers at this point in time that sometimes they just don't think about these things. And I think this raised the ability of our care delivery system to be able to step back, focus on the bigger picture.
Here's this woman who comes in complaining of chest pains and shortness of breath, and it turns out probably it was related to, you know, the situation at home. And she came to see the provider, and had we not asked those questions, maybe she wouldn't have gotten the help that she needed.
So I'm an embedded behavioral health provider in our primary care program, and I'm thinking about a 58-year-old patient who was referred to me as a result of having completed the patient health questionnaire, depression screener. So there's 9 items on the form, and he had not endorsed the first 2 items for depressed mood and loss of interest, but he had actually endorsed other items. He kept going and wanted to communicate some additional problems, including some pretty serious thoughts that he was having, and he shared it with the primary care provider, who really had not suspected, not known that he was under such distress. And the provider asked him, so you think you might be depressed? He said, I don't know, I might be. And he said, you want to talk to somebody about it? And so he said, I think I might. And so he came to me, and this opened the door to a lot of acute problems in his life. He was really in a crisis. So we mobilized. We helped him. Since the problem involved his family, we had subsequent sessions that involved family members. All from that one item that would not have been normally asked, but because we did that, it helped not only him, but other people too. You know, I really feel that, you know, you can't find enough ways to give people an opportunity to share what their problems are, and using that, giving him that piece of paper sort of gave him the door to start a conversation and to get the help that he really wanted.
It's not one individual that can make a difference in a patient's goals, but it's a team. So we've seen primary care physicians, social workers, care managers, nurse practitioners, pediatricians, and also organizations outside of the primary care practice with whom they develop relationships. So food pantries, for example, really work together to address the patient's needs.
Putting what the patient's circumstances are, what they're experiencing into the forefront, that really helps us take care of them. So I think that's something that has really helped not only impact hopefully patients' lives, but also like how we work and how we provide care.
One of the medical office assistants had a moment, had an epiphany in which she stated something to the effect of, wow, I can't believe that all those PHQs that I was performing, all those questionnaires that I was doing made your job easier.
When you call upon IT or the Epic resources to work on this, they got excited and they put in extra time and work, and marketing got excited about it, and the whole organization got excited about it.
It's not just about job descriptions and what can I do, what I can't do. It's what comes out of your heart. It's not just that, okay, you have to do this for the patient. You have to want to do it for the patient. It has to come from the love, from within.
What the screening does is it helps capture the information more broadly. It doesn't depend upon the provider thinking like, well, maybe the reason that they're not following the diet is because they don't have the money to buy the food, because that's being asked by someone else. And once you present that to somebody, it changes the kind of interventions that the providers use for the individual patients.
It's not just understanding and appreciating these challenges, it's being able to do something about it. And I would say, as a system, as the result of this, we as a system have built better capacities to link people to resources.
When a patient does come in, they can have their resources right there provided to them, and someone can follow up with them during the visit instead of following up a month later or anything like that. It's the continuity of care.
It can take a lot of time to get to know a patient and learn about his or her life, and to learn about what is bothering them, to perhaps have an inclination that, you know what, maybe I should ask this person some questions to see if they have a depression. But by doing a routine patient health questionnaire, you cut to the chase, the information is at my fingertips, I can focus on, instead of gathering information, acting on that information.
You don't often feel the vibrancy of an organization's compassion, but in this project, it was one of the moments that we did.
So all in all, this was really very encouraging and energizing with these quite small pilots, but now knowing that this is possible, having collected the benefits that both patients and teams say about using patient-reported information in primary care. So we hope that through this work, we can start to spread this knowledge These teams were small. They're not from necessarily large system with a lot of resources, yet they were successful at starting to implement and collect and use patients' voices, and not only introducing patients' voices, but also hearing what patients are saying.
You know, this is the first start on something I think the whole country is going to catch on to this fire, and you're leading the way with that.